Hi, welcome to Addiction Recovery Plays podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, Pat Tucker. Pat is a recovery work supervisor in the state of New Hampshire. Welcome to Addiction Recovery Plays podcast, Pat. It's so good to have you with us today.
Thank you. I'm glad to be here.
No, we are too. I'm really excited to talk to you. So can you tell us about yourself and your career journey in the addiction field, please?
Yes, I was one of those people years ago that had children very young. So I had 3 children by the time I was 23. And so I was spending most of my time, all of my time, raising them. I began to work part-time in order to just earn a little money. And so I went to Concord Hospital and I was working in the admitting office. And I worked there for about 12 years. And then one day, one of the doctors came and said, well, I'd be interested in joining his practice. So I went to work for Concord OB/GYN for another 12 years. By then, my kids were pretty much grown. I'd always wanted to go back to school, but I never managed to do that. So I was in my late 40s when I went back to school, and I had no idea what I wanted to do. So I went down to the tech school in town, and I said, I want to take classes, but I don't know what I should be. And so they had me see a career counselor. And she said, I think maybe you would be a good counselor. So I said, well, I could try that. So I took a psychology course. I fell in love with it and ended up starting there at the tech. By then, I was working at the multiple offender program, which was a program where people that had 2 or more DWIs came to us and we tried to educate them against drinking and driving. So I was working there. So I was able to work full time and go to school and still do my internships because they were nice enough. They wanted me to be a counselor. So they were nice enough to fit in all of my schedule. So one day I would work 2 straight shifts in order to fit that in. And I think looking back, by then a couple of my children, I had 2 sons and a daughter, and both of my sons were getting in trouble with the law. My brother, I was just talking to him the other day, and he reminded me that one year, both of them were in jail when my family came for Christmas, and I'd forgotten about that. So they were getting in a lot of trouble. So I think somewhere in my mind, I thought maybe I could save them or help them anyway. That is not what's happened at all. But I was led to the field of alcohol and drug counselor. Both of my sons have passed away, unfortunately, due to this awful disease. But I have stayed in the field, and I've learned a lot since then, that's for sure. And so I worked at the multiple offender program. Then I went back to Concord Hospital, and I worked in there as a LADC there. I've been a LADC for like 32 years. So I worked at the hospital, and I loved that work because I worked in the intensive outpatient program, and I also saw people one-on-one. But the thing I liked the best was doing consults in the hospital. If anybody came in for anything to do with alcohol or drugs, we would go up and talk to them. And we would try to tell them what we had for services and would they be interested in coming to get some services from our Fresh Start program. So people would come, and it really made a difference in their life. And we just, by us dropping by and somebody saying, you're important enough that you could get some treatment. And so that's what I did. Now I'm semi-retired, kind of, but I still have a private practice. I've always had a private practice, just seeing a few people when I had a full-time job, but now I don't have a full-time job anymore. So I see a few people, and I do quite a bit of supervision for other LADCs and CRSWs. And so I just see like a couple of patients, not a couple, but a few patients a week, and I do the supervision. So I love what I do. I still love what I do after all these years, and I will stop sometime, but I'm not sure when. That's a little bit about me.
Well, thank you for sharing that, Pat. That's an incredible journey, and the fact that you're still doing this work now is just testament to your knowledge and experience and your passion for the work in addiction and recovery. So, congratulations on that. I really that was wonderful to hear. Pat, when we first met, you told me about your work in recovery centres, which I wanted to talk about because that sounded so. Everything you've done is so important, obviously, but the recovery, the recovery centre work. I'd love to tell our audience about what you do there.
Okay, let me tell you about how our recovery center started. I live in a small town, and we have a very good minister in our town, and she got some people together, and she said, we really need to do something for all the people that have a substance use disorder in this town. So it was a wide variety of people, some just from the community, a nurse, and me and her and a few other people that said, some people in recovery, and they said, what can we do to help people? So she's a very smart lady, and so what we started to do was, we knew we had to have some money. So we started to have spaghetti suppers. So we would raise some money with spaghetti suppers. And then we moved on to a thrift store. We found a place that would have a thrift store. So we had a thrift store, and people would come in and buy things. And while they were in there, they got to chat with people and just talk about recovery. What would you like to do? So then we raised enough money to rent a building in our town. That was the old post office. So we rented a building. And now we have 4 different centers in 4 towns surrounding us. And I don't even know how many employees there are. There are a lot of employees. And there's a lot of CRSWs, which are certified recovery support workers. And so this is fairly new. This was about 7 years ago that we started this. And since then, we've been able to build that much. That's quite a bit. And now I don't even know how many employees there are, but a lot. And we branched out. Not only do we have recovery workers, we have people that work with families. We have families that come in and they get a lot of support. And we give the things that the Family Resource Center can do is just amazing. Counselors are really important, but these recovery workers, they sit down with people. They help them get insurances because a lot of people don't have insurance. So we help them get insurance. And that's really important to have insurance. And sometimes if their car's broken, they can give somebody some money to fix their car, or say their electric bill is going to be shut off. They'll give money to help their electric bill get paid. And they provide transportation. They got a little van. They got somebody to help donate a van. And so they provide transportation because we live in a town where there isn't a bus or anything like that. So transportation is really, really hard to find. So they'll take people to treatment. They take people, if they have a court date, they will take people to the court date. And they will sometimes stay there and support them. They can't say anything in the court, but they can just give the person support. So they give them a lot of support. And most of these people are in recovery themselves. So they know where this person has been. So they try to help them by sometimes sharing their own experiences. And they set them up with services too, like say they need housing. Housing is another whole subject. There's not enough houses. But they'll try to get them on the list for the housing and give them support in any way they can. And they'll call them like every other week or something and say, how you doing? And just somebody to say, how are you doing could be so important, because sometimes by the time people have burnt all their bridges, families get tired of it. Everybody gets tired of it because it's a terrible thing to have an addiction problem. So they help them a lot, and they feel comfortable with them because they have shared experiences like they are going through. So they can even go to their home and see them. If they can't get to the center, then they'll go to their home sometimes and see them, which is really a good thing. So that's what the recovery workers do. And they are fabulous. I love them. And what I do is I supervise in the recovery centers. So I help them. If they have a problem, they can talk to me, or I meet with them once a week. and we talk about things and go over things and figure out what to do next and that kind of thing. So I supervise quite a few recovery workers.
So you started this 7 years ago and you've expanded to full services in your community.
Yes, right. Yes. Yep. It's amazing.
It is. I mean, that's the only word it can be described as, really. So this was all self-funded as well. You just started small with your spaghetti dinners and then just grew from there, really.
And of course, now we have all kinds of grants and money, and the state gives us money. So now we have a source of income, and sometimes we raise money doing different things. But most of it is federal or state funded. And it's really interesting to see. And they have a play group. So for the little kids, they have a play group. And we've got some really good family support workers, too, that are very dedicated. And not all of them are recovery coaches, but they're employees of the Family Resource Center. So it's really amazing what we've done in such years. And a lot of it is due to Michelle. She's the minister that started this, because she's I'm not sure she sleeps, but she must sleep, but I'm not sure she does, because she's really high powered and she knows how to, write grants and things like that. So that's what we're doing.
And what are the names of your recovery centers, Pat?
It's called Archways.
Mm-hmm.
Archways, because we have a wonderful, huge arch in our town that was one of the founders of the town built. So we call it Archways. And there are archways in each town. There's one in Franklin, one in Tilton, one in Concord, and one in Plymouth. The Plymouth one is just the newest one. So, we have 4 of them.
Wow.
Well, I'm pretty proud of that.
Yeah. Yes, as you should be, Pat, because you are saving lives and families on a daily basis with this service.
Yeah,
you really are. So I do know, just so much admiration for what I've just said. That's incredible.
Well, I don't do much now except supervise, but those recovery workers are really great people. They really are.
Yeah, big shout out to the recovery workers, that's for sure. But big congratulations to you as well, Pat. That's just an amazing story. So there was something else I wanted to ask you about. You mentioned something called the doorways.
Yes.
Can you tell us about this project, how it works and how it's funded? It just looked incredible when I looked on the website.
Yes. I don't imagine all the states have doorways. No. So ours started in 2019. And it is a place where you can go. Most of the doorways are located in hospitals. And so you could go there and they will help you with whatever you need. It's mostly a lot of recovery related. So they will do an assessment say somebody comes in and they want to get help. So they can go to the doorway. And of course, the recovery center might give them a ride to the doorway, and they can go in. And they have LADCs there, and they have recovery workers, and they do an assessment for them and try to help them find out what will work best for them. So they have prevention programs. They have, they know where to get people in treatment, and they also know where to refer somebody for medication-assisted treatment. They know how to get them maybe a little financial help. If somebody goes to a recovery house, we're going to talk about that too, I'm sure, and they don't have money, because a lot of people, by the time they get to treatment, nobody wants to help them anymore. So if they go to a recovery house and they need a little help getting started, sometimes the doorway can get them a little help for a month or two, get paid the rent. And the doorway does all kinds of wonderful things, and they do it right away. So I had a gentleman at my office, and I said to him, "Are you interested in getting treatment?" He said, "Yeah, I am." They don't usually say that. So I called up the recovery center, and I said, "I have a gentleman here, and can you take him to the doorway?" They took him to the doorway. It was in the afternoon. They gave him transportation, and that day he was in treatment. And if you can do that, that is what saves lives. Because if he would have gone home, he would have thought about it. He would have thought, not always, but sometimes they say, "Well, maybe I don't want to go. I'll go next week." But getting him to treatment when he really was ready is one thing that saves lives. So he got a treatment, and he stayed there for 30 days and did well. And the idea is to get people what they need right away so that they don't think about it and decide not to do it, because that's what happens sometimes. So they offer a whole bunch of services there at the doorway. And I think that is really one of the best things that New Hampshire has, is the doorways. And we have them. There's, I think, 9 of them, I think. I'm not sure about that. I think there's 9. And they try to make it so that people within a 100-mile radius can get help. So that's why they're in the hospitals, because, of course, there's hospitals all over the place. So a lot of them are in the hospitals. And that's what the doorway is.
Wow. That sounds just a wonderful service. The fact that you're able to get one of your gentlemen into treatment in the same day, that's almost unheard of.
Well, it used to be that you would want to go to treatment and you had to get yourself on a list, and then you'd have to wait. And by the time you got there, who knows what could have happened to you? It could have gotten so much worse, or you could have died, actually. And so this is a great thing that they could get where they need to be right away. Yep.
Yeah. Well, we'll put a link to the Doorway website in the link below this podcast so people can check it out, because I think you should really look at it. It's a wonderful service. Pat, when we first met, I always ask all my guests, how's your state dealing with the opioid crisis? And you mentioned that overdoses are down in New Hampshire, which is wonderful to hear. So what is it that your state is doing to help your community that's hopefully working?
Okay, what I think is, I think they're down for a few reasons. One of them is the doorway, where people can get help right away. And New Hampshire is, as a state, is giving money for these services, which is really good. Getting people to treatment right away is good. Narcan, we're using Narcan. We're trying to train more and more and more people with Narcan. I think one thing, too, is there's more mental health treatment, because mental health and substance misuse goes right along together. So there are counselors that are mental health counselors, plus they're LADCs. And so people are getting more treatment for mental health, which helps an awful lot. There's more medication-assisted treatment, which is very helpful to people. And the sober houses. Years ago, you'd go to treatment and you'd get out of treatment and they'd say, okay, now you run along and see what you can do with this. And people wouldn't know where to go. Sometimes they didn't have a place to go. They did not know one person that did not use drugs or alcohol. And so the sober houses, I think, have really, really helped because there's a safe place for people to go and they meet people that are going to help them. So I think that's why I think they're down. Could be other reasons too, but I think that's a lot of why their overdoses are down.
Well, I think judging on what you've spoken to me about in this podcast, Pat, that the work that you and your community are doing is having such a big impact as well because of the services that you put in place. There's no doubt about that. You mentioned that you have a well-established MAT service in New Hampshire. What is it that New Hampshire is doing to make this more successful than other states that I've heard about?
I don't know about other states, but I know what we're doing here. And we have a lot of places that give out MAT services. And I think one of the important things is that people have access to insurance now. And that's very important because then they could go to the medical facility and get medication-assisted therapy. And I think that it's just more available all over the whole state, which is really good. And I think that medical personnel have learned more about addiction. And I think that there's more people, like I know in my area, there's more people that are physicians and APRNs that are really interested in working with people with addiction. And so that's really good, I think. Yeah. And most of the places where they go for MAT have a counselor too. So they can see the MAT provider, plus they can get counseling. And if you get counseling when you're seeing the MAT provider, I think it works better.
Yeah, much better combination, that's for sure.
it's more effective, let's say.
Yeah, absolutely. Absolutely. It's great to hear that New Hampshire are really tackling this, because you're putting into place all the services that are required. And you also mentioned that doctors are now wanting to engage more with clients with addiction. So clearly stigma is getting less so, which is lovely. I'm going to ask you about stigma later, but it seems that that's probably one of the biggest cruxes to enter treatment, I think, really. But
Right.
Pat, you also worked in the criminal justice system in New Hampshire. Can you tell us about your vast experience working in the sector and what you enjoyed most about working with clients involved in the criminal justice system?
That was where I started, was with the multiple offender program when I first started. And I saw just great things happen there. That program was set up that people that had 2 or more DWIs, they would go to the jail for 3 days. And most people being in jail for 3 days was really traumatic, because up until then, that's not how it was treated until they did the multiple offender program. So the jail part was really good, because by the time they got to us after the jail part, they were thrilled to be out of jail. And so we had kind of a little thing there that was good going on. So they would go to jail for 3 days, and they would come to us, and they spent a week with us. And we gave them group counseling. We gave them a lot of education. We educated them about AA and what a sponsor was and what they could help you do. And so they stayed for a week. We fed them so good because we had great cooks. And for some of them, it was so great because they got to be in a safe place where they could learn about how not to get another DWI. Because getting a DWI, and especially getting 2, is not a good thing for people to do. So I saw what happened there when people just got a little bit of education, and I saw really good things happening there. That was one of my best jobs I ever had. It was just good working with them. And a lot of the people that we had working there were in recovery. People in recovery tend to go, or people in recovery, or if you've got some kind of interest in this field, that's who goes into this field. So all of our dorm supervisors, in fact, maybe all of them, not quite maybe all of them, but most of them were in recovery themselves. So a lot of the work went on after we got through educating them during the day. They would sit and chat, the people that were the dorm supervisors, and they would learn a lot from them too. So that was really my first experience with any kind of criminal thing. Then I work quite a bit with people that are coming out of jail or prison. And I love working with them because most of them just need to figure out how to stay out. Because nobody has come to me ever and said, I really thought that jail was a great place to be. I'd really like to go back there. None of them say that. They say, I don't want to go back there, but they don't know how to not go back there. So I love working with people that are coming out of some kind of incarceration. And I've had some really good experience with people turning their lives around. I had one gentleman, and every time he would get out, he would call me up. I got to come back and see you. So he'd come in, he'd stay out for a little bit, and then he'd go back because he didn't know how to not use. So every time he'd get out, he'd call me up. I got to come back. He probably did this 5 or 6 times. And then finally, he went to treatment after he got out, and he's been able to stay out now for a while. So I really just love working with motivated people like that because they're motivated to stay out of the system. And now in New Hampshire, I don't know about other states, but now in New Hampshire, it used to be they would put them back in jail. If they drank once, they put them back in jail. Now the parole officers are working more with them to stay out. So they will refer them to a counselor. We have other counselors that are really working with people out of incarceration too. And they'll refer them to them. And they're going to treatment and they're getting help. And they're going to the sober houses, which is really good. Because before they would release them from jail you get out there, again, you do the best you can. And I don't know where you're going to live because they don't have any resources. I don't know where you're going to live because everybody uses. So, but you try to stay out. But now they are helping them stay out, which is a good thing by referring them to treatment, by having them go to a sober house, which is good because then they get a lot of support there. So
yeah. You mentioned sober living houses and the programs, Pat. So can you just explain to our audience, like, how do these programs work and how do people access these services? Because it just sounds such a vital component of recovery.
For the sober houses? Oh, okay. Yeah. The sober houses, that's fairly new. At least it's fairly new in New Hampshire. Because before, like I said, people would go back to the same environment and they didn't have a chance to not use if everybody was using. So sober houses started springing up places. Somebody figured it out. And so sometimes people have like a whole motel that they'll buy and turn it all into sober houses, so you can have quite a few people. Or people will just have like place that will hold like maybe 8 or 10 people. So the way that works is they put in an application to get into the sober house, and oftentimes, again, people that own the sober houses are really involved in recovery, and so there are rules with the sober house. You can't just if you keep using substances, and they might give you a chance, but then you either have to get back in treatment or you have to figure out how to stop using. So they have a lot of good things in the sober houses. It's really good because they're around people that are all with the same goal. So that's really good. And so they help them find a job. They learn basic skills like how to live, because when people are engrossed in the addiction, they don't learn many skills. The idea is where you're going to get whatever it is you use next. So they teach them skills, and they're around people that are abstinent too, so that they can be connected to something. And they develop a really good connection there to other people. And they help them get to AA. They help them get a sponsor and that kind of thing too, so that they can, it's really good for people too, that even if you have a family, it's good to go to a sober house for a while, because it's kind of hard for people to go back to the family structure and have to jump right back in and work really hard, like taking care of kids and going to your job and all that. Because it's great if you can have a period to work on yourself and figure out what you're doing in recovery. So sober houses give people that opportunity, and they have to eat well, hopefully eat well, and get the right amount of rest and that kind of thing that people forget how to do when they're in the active addiction. So they really are good, and they made a big impact on people being able to stay in recovery.
Yeah. How are they funded, Pat?
How are they funded? People pay. They pay.
Yep.
People have to pay to be there. Like, again, the doorway, or sometimes there's funds for people temporarily. But then they have to get a job, or if they're on disability, they would have to volunteer maybe somewhere to learn responsibility. And but then people pay, and it does come out that they pay enough that the person can run the sober house, because of course they have to pay their mortgage or whatever they have to do. So that's how they make them go. Yep.
No, it sounds such an important part of the whole process. It really does. It's great to hear that New Hampshire have got these as well. I'd just like to mention, you mentioned when we first met, Pat, that you work with young people in the community. Can you tell us about the vital work that you do for your community as young people?
Young people?
Yeah.
Well, we have a coalition in the nearby town, and I have been a volunteer with them for quite a while. And what we do is, we have a great person that leads that too. She's a young person that's really great. And the coalition is to try to get young people to get involved in things that are not alcohol or drug related. And we know what those things are. The first thing they usually start with is vaping.
Yeah.
And so we try to educate them against all those things. Young people are hard to work with because a lot of what they do is peer related. And if their peers do it, they do it. And but we try to get them going in a different way. So they work in the school to educate against vaping, against substance use. We would have a great opportunity in our town because we started a white water recreational place. So the rivers come to meet in our town. I'm not explaining this very well, but so there's whitewater rafting, and so we try to get some kids interested in that rather than hanging out on the street corner. Yeah. We'd have some not classes, but groups in schools, and we try to get them together, and so they could talk about things. Because unfortunately, this is a thing that is passed down from generation to generation. So not all kids are getting what they need at home. So they have a group that gets together and they can talk about anything they want to talk about, but we try to encourage the kids getting active in things that are good for them. And the whole idea is to help them make better decisions, because you can't follow them home. You can't do anything to really make them do anything. But we have groups that try to help them make better decisions and better choices, because that's what it's all about. It really is about it, whether you're an adult or whether you're a young person. But that's what they do. And they have good role models, and we try to talk about healthy lifestyles. And a lot of what they work on, too, with young people is trying to build good self-esteem, because if you grow up in a home where there's no direction, no structure, anything like that, it's hard for kids to have good self-esteem. So we try to work on that to help them with that. And it's hard with young people, though, but I'm just on the board for that. So I don't really do any of the actual work. We just talk about what you could do and that kind of thing. But I have been doing that for a while. I also, there's another group that I help out a little bit if she needs it. Another good dedicated person that's been working with young people for 28 years. She's been working with young people that are getting in trouble. And so once in a while, I'll go and sit in on a meeting to kind of get that kiddo going in a better way, coming up with a plan of what they can do. Like sometimes we have them do community service. Community service is a great thing for a young person because it makes them feel better about themselves. Plus they're helping. And so I had neighbors that were elderly, and they went across the street and helped them rake. And so that was just good because it makes them feel like they're being productive, and it helps the people that are elderly. So community service is a good thing, like to teach people to do, and it makes them feel better. And anything we can get a young person to do that makes them feel better about themselves is really a good thing, I think. So that's what we do with them. But that's an ongoing thing. But we do have a good coalition, so we're trying. That's about all we can do with that.
Yeah, it sounds wonderful, the work that you're doing with the young people, and the fact that you've identified vaping as being the first potential problem with health as well, because that does need addressing, that's for sure, especially with all the new vaping pens. Yeah,
the vaping is really, really prevalent, very much so. Yeah, my office happens to be right across from the vape shop. Oh my Lord. I've got one across from my office and one right beside me. And the traffic in there is unbelievable.
Really?
Yep.
Oh, my goodness.
That's anything. I don't know.
Yeah. Wow. Well, congratulations on the work that you're doing for the young people as well, Pat. That's highly commendable. It really is. I just want to move on a bit because we met through the organisation LADC. And can you explain why you're a member? And what do you get from being a member of this brilliant organisation?
I think I've been member of that ever since I've been a counselor. And somebody told me it would be a thing to do that. So back then, I believed whatever they told me. And so I joined. And I think that NADAC is very helpful. They set the standards for our profession and brings people together, which is a good thing. And that is how I found you. I was just looking at their website, and I saw that you were looking for people from New Hampshire. And I said, well, how can he not have anybody from New Hampshire? We're doing such good things here. So I got in touch with you, and then we decided to do this. So, but they do a lot of good things for our field. One thing that they really do, we have a great state representation too with the HADCA, and they have all kinds of wonderful trainings that are very reasonably priced, because I didn't realize that, like, mental health counselors, their trainings are so much more than what we have to pay, because everybody has to have CEUs to get their license renewed. So it's really great that they have trainings that are reasonable, and they're with professional people. They have people come from all over the country to have the trainings. So that's really good. And I think that it's just good to be in NADAC and HADCA. It's because you get to talk sometimes with people that have a like interest, because not everybody understands about substance use disorders, and they certainly do not understand about that. And so it's good to have people that know what you're talking about. Yeah, I think it's a good. Like I said, I've been in it since I started counseling. So
I take it you'd recommend to someone who's considering embarking on a career in recovery and addiction to look into becoming a member of NADAC, Pat, yeah?
Would I? Yes, definitely. Yeah.
Mm-hmm. Yeah.
And it's not that much money. It's not that much money at all. So it's a good thing. Yeah.
Yeah. It's a great national organisation. It's wonderful to be a very small part of this. It really is. And meeting wonderful members like yourself, it's been very inspiring for me as well. You mentioned a word earlier that I always speak about on these podcasts, Pat, and that's stigma of addiction and mental health. Why do you think this is still such an issue with people wanting to access services for the disease of addiction?
I think it has gotten a lot better since I've been in the field, since I started in the field. I think it's gotten a lot better, but we've got a long way to go. And stigma with substance use disorders it's so prevalent, because mostly what you hear about someone that has a substance use disorder is bad. You see them get arrested. You see them get in trouble. You see them die. And so that's what you think of with a substance use disorder. When someone gets in recovery, you don't hear so much about that. And that's what it's all about, is for people to get in recovery. So if we can get more people in recovery, that's just a good thing. But it has been different, I think, in all these years. And the thing that I'm finding is we're a lot more people that have a substance use disorder are talking about it, which is really good. Like even actors and people like that. It's not so hidden like it used to be, which is a really good thing. And that's how we're going to stop it, is by it not being hidden. And the more people talk about it, the better. But it's hard to talk about it because people do all kinds of things that are not too good if they have a substance use disorder. And so I would like to see more people talk about recovery, because I know people that have gotten in recovery and their life is so totally different than it was when they were in the substance use. It's not even like the same person. I mean, they build multi-million-dollar businesses. They take care of their kids. That's what I love about this field, is when people are able to take care of their kids more. And that's really so good. But I hope it's going to continue to get more and more of where there's less stigma. And I think the recovery centers are helping with that too, because they're open. People will talk in recovery centers a lot, the people that work there, about this. So I think that they anybody that you can get to talk about it is really a good thing. The other, not too long ago, I went to a meeting at the recovery center, and there was a lot of policemen there. I don't even know how many there were, but there were at least 12 or 14, maybe even more. And they were having a presentation there about Narcan and about helping people that when they get arrested, maybe they could mention to the person that they're bullying, would they like treatment? And so and the recovery coach that was getting the presentation, she was willing for them to call her, she'll go over and talk to them about treatment. And so that might be a good time to get people interested in treatment. Why not? They're sitting in the police station. Can't get much worse than that, right?
That's right.
So I think that's such a great idea and we're trying to educate people about addiction and how it's not a moral thing at all. It's a disease. I totally believe it's a disease. And that if they can just treat it as a disease rather than a moral issue, we'll be better off. And talking about it, I think, is what is going to be the difference with the stigma. And I think we're working on it. I think we're getting better.
Yeah. Things certainly are progressing somewhat. It's very slow pace, but at least we're moving in somewhat of the right direction. I couldn't agree with you more what you just said then, Pat. So thank you so much for that. That was beautifully explained. Last couple of questions. I ask all my guests this question because I get some very interesting but varied answers. But can you tell me your opinion of harm reduction and how it plays such a pivotal role in recovery?
Okay. I'm so glad you asked this because a few years ago, when they first started talking about harm reduction, I said, what the heck is that? What? Because what we were teaching years ago when they went to treatment was you get out of treatment and you go home and you go to AA and you get a sponsor. You go to 90 meetings in 90 days. You shut your mouth. You don't say anything. You don't think. You do what your sponsor tells you to do, and you'll be all better. Well, it did not work. So I think the harm reduction, like I said, when they first started talking about it, I thought, that's not going to work. But the more I do it, the more I work with it, the more I understand it, it works great. And it is saving lives. It's another thing of saving lives. So I think that we have to keep trying to figure out more ways to reduce harm. Now we do the needle exchange. When that first started, I thought, oh my God, why would we want to do that? But now I understand that if people have clean needles, they can live rather than having not clean needles and they could die. So anything we could do to keep people alive, I am for. So if we can keep them alive until maybe they can get in recovery, that would be really good because if they die, then we can't help them at all. So anything we can do that's harm reduction, I'm all for it now. The Narcan, we're having a lot of, we give out Narcan everywhere. And it's really good because you can save people's lives with Narcan. So we do a lot of that. Even condoms, that's a really good thing. If we don't have unwanted children, that's a harm reduction. And now that it's New Year's Eve, right? Taking a cab tonight so that you don't get in a DWI, that's a good thing. Because I was just listening to the radio and they said almost all the accidents are caused by people either speeding or impaired driving. So if we could cut down on that, that'd be a good thing. And I am working a lot with people now that do not want to stop drinking, but they want to cut down, and they're having success cutting down. So if they can cut down on their drinking, not everybody can cut down, but some people can. And if they can cut down, it's going to be less medical problems. It's going to be less DWIs. It's going to be less everything. So I've got the concept of that now. But at the beginning, I was thinking, oh, my goodness, we don't want to be doing that. That we're encouraging substance use, but I don't believe that at all anymore. I think we really are helping people by anything they could do to make their life a little bit better. That's a good thing. And I think harm reduction works. Yes.
Yeah. I'm a big fan of it as well myself, Pat. So
yeah.
Last question. Do you have a message for anyone who's listening to this podcast who is going through an addiction?
Yes. My biggest thing is, if you have a substance use disorder, don't give up. I know people that have went to treatment 30 times, and the 31st time, it helped. Don't give up. Keep trying. Keep seeing somebody. Keep talking. Keep doing what you can. Don't give up. I'd like to mention to families, too, for families not to give up. Keep loving that person because hopefully they can get in recovery someday. And if you're working in the field of addiction, yes, this is the addiction anymore, but I still use that term. If you're working in the field, take care of yourself, because if you don't take care of yourself, you cannot do this work. This work is really, really, it's so wonderful to do it, but if you get burnout, you can't do it. And the vicarious trauma is a real thing, because we don't, we deal with people that had problems. That's what it's all about. So we really have to take care of ourselves, and that is so important for people in the field, I think.
Yeah.
So that's about all I know.
Incredible knowledge, incredible experience, Pat. It's been a genuine honor and a privilege to hear your story and to hear your work and what you're doing in New Hampshire and what you've grown. It's just something quite inspiring. So I hope people listening to this podcast can really take note of what can be achieved, because you've delivered. You really have.
It's really amazing what I have seen happen in 30 years. It's really, and I still just love doing what I'm doing. I just love it. And I'm going to retire sometime. I just don't know when. And if anybody wants to get in touch with me, I don't have a website, but I can give you my telephone number and they could call me. And what I do quite often now is people will call me, and it won't be what I could do, but I try to point them in the right way to find what they need. So if anybody wants to call me, my number is 603-286-9584, and I will try to point them in the right way. Because what people are telling me is that there is such a need now for mental health counselors as well as substance use counselors that nobody even calls them back. They'll leave like messages on people's telephone for a lot of messages and nobody calls them back. I think because there's so much need now. So I try to I hunt around for them. I'm kind of like a clearinghouse. And I try to find what they need. And if I can't find, tell them, if you can't find someone, you call me back and I will help you again. And nobody ever calls back. So I guess they're getting some help they need. So that's good. So
wow. I'm
a clearinghouse.
I love it. Well, Pat, as I said, thank you so much for your time today, and thank you for everything you're doing for your community. It really is. It's been lovely talking to you today. Thank you so much.
Thank you so much.
Thank you, Pat.